Okay guys, so in this video we're going to go through a simple exercise that you can do with patients who've got neural symptoms and neural tension symptoms. So potentially you've done the straight leg raise or the slump test and they're positive. These sorts of things can be really nice to improve neurodynamics. They can be messed around with. There's no hard and fast rule with these. We're going to go through 3 progressions that kind of illustrate the way I would generally go, but again you can modify things, and we'll talk about that as we go along. So what I've got is Patrick on his left hand side. We're going to pretend that he's got a right-sided issue or right-sided problem into that right leg, so lower back pain potentially, and then symptoms down the right leg which have been confirmed with a positive straight leg raise and slump test. So what we're going to get Patrick to do is knees together. We're going to get him to make sure, Patrick, you just keep that foot in that position. So we're going to make sure dorsiflexion is maintained. Chin to chest to start. And then as you, I want you to extend this knee and extend the head back at the same time. Okay, so if you do that for me, that's good. And then back again. So we're gliding that nerve, taking the tension off at the top, and we're adding tension at the bottom. Okay, so that would be more of a initial thing that I would do. Again, what you could do if they were very, very irritable or the severity was high, you could do that and actually say, Patrick, if you just let your leg keep like that and don't dorsiflex, and do the same thing. So you could do that, perfect, and you could then add the hip head extension as well. So add, yeah, perfect. So that's even less because you've got plantar flexion, so we're reducing tension at the bottom and we're reducing tension at the top. And relax. It's good. Then what we could do is maintain the head inflection, so we're increasing the tension here, and then just do a plantar flexion as we did before, Patrick, and just extending the knee, nothing at the head. So now we're adding tension at the top, but we're reducing tension at the bottom. And then our third progression would be dorsiflexion here, and then the same thing. So dorsiflexion and extension of the knee, and relax. It's good. And just basically getting the patient to go and relax. Usually, I always say with these sorts of things, you want an off-on. So again, we don't want to hold the stretch position for any length of time. Obviously, with your neural dynamic work, you want to really ease into the positions, and usually you're doing around 30 repetitions, but it's just literally an off-on, off-on. I would always get them to go to where they feel comfortable. So again, it might be that range is really quite short to start with, and that's absolutely fine. And then what you could do is go back to your straight leg raise test after doing this for 1 to 2 sets, and see whether you've made some progression through there. The other thing that often this will improve, as I've found in clinic over the years, is their forward bend. So often their flexion will improve when you've done this with low back pain patients, and they'll feel easier, they'll feel like they can get down and increase that movement. So obviously you can do the neural glider hamstring exercise, or neural glider, sorry, exercise in a different position. So you could always do these sorts of things in lying on the back or in a slump position, so in a straight leg raise or in a slump position. But we'll do those on another video. This is just a really nice one because I think sideline position generally for patients is quite comfortable, and they can just really go into where they feel they can do. So that is a side lying neural glider exercise for the sciatic nerve.